Often there'll be at least 2 or 3 or 4 people around the baby. I'm fairly short, so I'm fortunate, but certainly there are others who are taller than me, and when you're leaning over the baby, this overhead warmer can certainly be an obstruction.
The nurses and staff who work in the maternity ward of the Medicine Hat Regional Hospital are routinely charged with the task of bringing newborns safely into the world. And most any young mother out there would agree that any equipment that makes their job that much more successful is well worthwhile. One of the items the Health Foundation is looking to acquire this year is a next-generation baby warmer, which can be crucial during the first few hours of life.
The Panda infant warmer would be a great asset to our labour and delivery unit. It increases our ability to help some of our more needy babies make their transition from birth into a nice, warm, safe environment. With the new one, the vertical piece only comes out about so far, and the heat radiates just to the baby and not to the staff, which is a lot more comfortable to work in, but safe for the baby. It delivers the heat directly to the baby and not to the staff, who certainly don't need higher temperatures to add to the already adrenaline-filled room.
One of the concerns the staff have with the current equipment is that the alarm monitor on the unit needs to be disabled with a push of a button, which runs the risk of an unsterile environment.
Another improved feature is the hands-free alarm system, which reduces the actual physical contact the staff have to make with the warmer, while gloved and possibly contaminated with body fluids. And that is our alarm, which we have to press a button for. The alarm system has a hands-free way of switching off the alarms, so all you have to do is wave your hand in front of it. You don't actually have to touch it, which certainly is more hygienic.
Many newborns need assistance breathing right off the bat, and the Panda warmer allows this to be administered with less possible complications.
Last but not least, one of the most essential features of any warmer during resuscitation is the ability to administer positive pressure ventilation with as little risk or trauma to the infant as possible. The built-in T-piece resuscitator on this warmer does exactly that. It is concise, consistent, and easy to seal, therefore making the whole resuscitation process more accurate, safe and reliable. This has been used in many units for many years and works perfectly satisfactorily, but you do have to be well trained to use it, and there is much less risk with the T-piece for overinflating or underinflating a baby's lungs, so making it just that much safer to use.
Technical talk aside, the bottom line is that the Panda infant warmer will make those first few hours of life better for the babies.
We've always had a very high standard of care here and a very high level of success rate with bringing babies round and helping them to be resuscitated. This will make it that much easier for the staff, that much easier, therefore the outcome for the baby will be that much better. You know, there's no separation